Imagine a magnificent horse, powerful, graceful, just a picture of health. But even these incredible animals can face these really subtle, kind of persistent health issues, often in places you wouldn't expect. Today, we're diving deep into one of those. Equine immune-mediated keratitis, or IMMK for short. It's this fascinating, often chronic eye disease. Affects the cornea, the clear front part of the eye. But it's probably not what you're thinking of when you hear eye problem.
Exactly. And our mission today for this deep dive is really to unpack IMMK using the sources we've looked at. We want to get into what it actually is, how vets figure it out, because diagnosis can be tricky, the complexities around treatment, and what the future might hold. So you can walk away with a really solid, well-informed understanding.
Okay, so let's pull back the curtain. IMMK, you said it's a group of chronic corneoconjunctival diseases. Chronic meaning what? Lasting a while?
Yeah, typically we mean inflammation that's been present for more than about 3 months. But the real key here, the core concept, is immune-mediated.
Immune-mediated. Right, so not like a typical infection from bacteria or a virus getting in.
Precisely. It's not an outside invader. It's the horse's own immune system essentially malfunctioning, causing inflammation within the cornea. An internal issue, not an external attack. And crucially, it's generally what we call a non-infectious, non-ulcerative inflammatory disorder, meaning usually no open sores or ulcers on the eye surface.
Okay, that's a critical distinction. So what does this actually look like in the horse's eye?
Well, the common signs are pretty distinct. You'll see chronic corneal opacities, cloudiness, basically. Variable levels of cellular infiltrate, which can look like yellowy white spots or deposits on the cornea, and often corneal vascularization, new blood vessels growing across that normally clear window.
Sounds quite dramatic visually.
It can look quite dramatic, yeah. But what's often surprising is that the discomfort, the pain level, and any secondary inflammation inside the eye, called uveitis, it's usually only mild to moderate. You might expect the horse to be in more pain given the appearance, but often they're not terribly bothered compared to, say, a bad ulcer.
Interesting. And does it affect certain horses more than others?
Not really, according to the sources. All ages, all breeds can be affected. It's often unilateral, just one eye.
Just one eye, okay. That it can be both.
Oh, yes, it absolutely can affect both eyes.
Yeah.
Which obviously makes things more complicated for the horse's vision and for management.
Right. And you mentioned it's a group of diseases. It's not just one single thing.
Correct. It's actually classified into 5 forms, mainly based on where the inflammation is located within the layers of the cornea. This location, this depth, is really important.
Ah, okay. So what are these forms?
Well, you've got the more superficial ones, the epithelial and superficial stromal forms. Sometimes these are thought to be maybe earlier stages of the disease. They affect the very top layers.
Okay, surface level, then deeper.
Then you have the midstromal form affecting, well, the middle layers of the stroma, which is the main structural part of the cornea.
Got it. Epithelial, superficial stromal, midstromal. What's next?
Then we get to the endothelial form. This one affects the endothelium, which is the deepest single layer of cells on the inside of the cornea. Its job is crucial. It pumps fluid out to keep the cornea clear. So when you get immune cells attacking there, you often see significant corneal edema, that fluid buildup, which gives the eye a kind of blue, hazy look.
And that sounds problematic if that layer is damaged.
It is. And unfortunately, this endothelial form is often noted as the least responsive to medical treatment. Really challenging.
Wow, okay, so that's 4. What's the 5th?
The 5th type is eosinophilic keratoconjunctivitis, or EK. Now, it's still immune-mediated, but it's distinct because the main inflammatory cells involved are eosinophils, a specific type of white blood cell. And this form, EK, it can sometimes involve more significant discomfort for the horse compared to the other types.
So understanding which of these 5 forms is present is pretty crucial then for the vet. It really impacts how they approach it.
Absolutely. It guides the prognosis and the treatment strategy, which brings us to the underlying why. What's actually going on with the immune system here?
Yeah, what causes the immune system to go haywire like this in the eye?
That's the million-dollar question, and the honest answer is the exact mechanism, the pathogenesis. Well, it's not fully understood. We know it's about a dysregulation of the local immune response in the cornea.
But there must be theories, right?
Oh, yes. Several leading theories. One is a classic autoimmune response. The immune system mistakenly identifies the horse's own corneal proteins as foreign and attacks them. There's even research suggesting autoantibodies against a specific protein called equine maspin might be involved.
So the body attacking itself. Scary thought. What else?
Another idea is maybe an excessive ongoing reaction to some kind of persistent trigger that the body can't clear. Maybe a fragment of a virus or some other foreign protein that isn't causing an active infection itself, but it just keeps stimulating the immune system inappropriately.
Like an allergy that just won't quit, but inside the cornea.
Sort of, yeah.
Yeah.
A persistent stimulation. And regardless of the trigger, the result is this chronic inflammation. You get lymphocytes and plasma cells moving in, causing swelling, new blood vessels, and eventually fibrosis, which is scarring. That scarring is what causes the opacity and ultimately the vision loss. It's like the eye's natural ability to suppress immune responses, something called immune privilege, gets overwhelmed.
That breakdown of immune privilege, it really underscores why IMMK is so persistent, doesn't it? It's not just a simple fix.
Exactly. It's a fundamental issue with the local immune control.
Which leads us neatly into diagnosis. And you mentioned earlier this is often a diagnosis of exclusion. That's
Astri. Diagnosis of exclusion means you can't just do one test and say, yep, it's IMMK. You have to systematically rule out other possible causes first, especially infections. This is absolutely critical.
Why so critical? What's the risk of getting it wrong?
The risk is huge because the main treatments for IMMK involve suppressing the immune system, usually with steroids or similar drugs. If you give those drugs to a horse that actually has a fungal or bacterial infection,
Oh no, you'd make the infection much, much worse.
precisely, you could potentially lose the eye. So ruling out infection is paramount. The diagnostic process is really like detective work.
Okay, so walk us through the detective work. What's step one?
Step one is always a thorough eye exam, looking closely at the cornea for those signs we mentioned. The opacity, the blood vessels, the cellular infiltrates, any swelling or edema. And a key test here is the fluorescein stain. IMMK is typically non-ulcerative, so this stain, which highlights ulcers, should be negative. If it's positive, you're likely dealing with something else, at least initially.
And you also mentioned the discomfort level is usually low.
Generally, yes.
Fair.
Compared to something like a corneal ulcer or severe uveitis, horses with IMMK often show surprisingly minimal pain or squinting, though again, the EK form can be an exception.
Okay, what else during the exam?
The vet will also check inside the eye, the interior chamber, looking for signs of significant uveitis, usually not a major feature of IMMK. And they'll check the intraocular pressure, which is typically normal, helping to rule out conditions like glaucoma.
Got it. Exam done, fluorescein negative, low discomfort. Now, how do you definitively rule out that underlying infection?
That's where lab tests come in. Corneal cytology is essential. We gently scrape some cells from the corneal surface.
Sounds delicate.
It is. And we examine those cells under a microscope. We're looking for the type of inflammatory cells, lymphocytes, plasma cells, maybe eosinophils if we suspect EK. But crucially, we're looking for the absence of bacteria or fungi.
Okay, so seeing the right inflammatory cells, but not seeing infectious agents.
Exactly. And to be even more sure, we often perform a corneal culture. We send a sample to the lab to try and grow any bacteria or fungi that might be hiding there. A negative culture provides more evidence against infection.
Any other tests, maybe for viruses?
Sometimes, yes. If there's a clinical suspicion, PCR tests can be run to look for specific viral DNA, like herpes virus, although viral causes are less commonly confused with typical IMMK presentations. And for really deep or unusual lesions, a corneal biopsy for histopathology might be needed. That gives the pathologist a tissue sample to see the characteristic inflammation pattern deep within the layers.
Wow, quite a workup. Anything else to help?
There's mention of digital infrared photography sometimes being used. It can apparently help differentiate between active cellular infiltration, which is the inflammation we want to treat, and fibrosis, which is just inactive scar tissue. Helps guide treatment decisions.
Okay, so after all that detective work, ruling everything else out, you finally land on an IMMK diagnosis. What's the treatment philosophy then? Is it curable?
That's the tough part. IMMK is generally considered manageable, but rarely truly cured. The philosophy is about controlling the abnormal immune response and managing the inflammation, often requiring long-term, sometimes even lifelong therapy.
Lifelong therapy. That's a huge commitment for the horse owner. What does that actually look like day to day?
It means dedication. Trying to get eye drops into a horse, sometimes multiple times a day, every single day, potentially for years. It can be a real challenge. It requires patience, good technique, and a strong bond with the horse, or sometimes clever management strategies. The reward, though, is maintaining the horse's comfort and vision. But it's definitely not easy.
So what are the mainstays of that medical treatment? What's in the eye drops?
The cornerstones are typically topical anti-inflammatories and immunomodulators. Topical corticosteroids, like prednisolone acetate or dexamethasone, are very potent and effective at reducing inflammation.
But didn't you say steroids are risky if there's an infection? What about ulcers?
Exactly. That's their major drawback and why the diagnosis has to be secure. Corticosteroids are contraindicated, meaning absolutely not used if there's any suspicion of a corneal ulcer or an active infection. They suppress the immune system and inhibit healing, which can make ulcers or infections explode.
Okay, so powerful, but handle with extreme care. What are the alternatives, especially for that long-term management where you want to avoid ulcer risk?
That's where drugs like topical cyclosporine A, often called CSA intercronimus, come in. These are immunomodulatory agents. They work differently, more specifically targeting the activation of T cells, those key immune cells driving the inflammation. The big advantage is they don't significantly impair corneal healing or promote infection like steroids can. So they are often the preferred choice for long-term chronic management.
That makes sense for long-term safety, but we still have the challenge of getting drops in the eye daily, potentially forever. You mentioned clever strategies.
Yes, and this is where technology has provided a real game changer for some horses. We now have surgically placed sustained-release cyclosporine implants.
Implants in the eye.
Well, placed just under the conjunctiva, the tissue surrounding the cornea. They're small silicone devices that slowly release cyclosporine over a very long period. We're talking months, sometimes even years, depending on the specific implant.
Wow. So one minor procedure potentially replaces daily eye drops for years.
Exactly. It dramatically improves owner compliance, obviously, because the daily struggle is gone. And it provides consistent medication levels right where needed. It's been a huge advancement, especially for horses that are difficult to treat daily or for owners who struggle with that routine.
That sounds incredibly helpful. Are there other options if medications, even the implant, aren't enough? Surgery.
Yes, for cases that are refractory, meaning they don't respond well to medical management, surgical options can be considered. Things like a superficial keratectomy, where the diseased superficial corneal tissue is surgically removed. Sometimes conjunctival grafting is done too. And we shouldn't forget supportive care. Things like UV protective fly masks can be really beneficial, reducing potential irritation from sunlight and flies. Managing the horse's environment is part of it too.
Okay, now this is exciting. Our sources mentioned some really cutting-edge stuff, promising new interventions for long-term control.
Yes, this is where things get very interesting for the future. Two newer approaches have shown real promise for potentially providing long-term control with minimal ongoing treatment.
Tell us about them.
One involves using the horse's own stem cells, specifically autologous bone marrow-derived mesenchymal stem cells. These are harvested, processed, and then injected just under the conjunctiva near the affected cornea.
Stem cells. How do they help?
The idea is they have potent anti-inflammatory and regenerative properties. Studies have shown these injections can lead to a significant reduction in corneal cloudiness and degeneration in horses with IMMK.
Okay, that's one. What's the other?
The other is photodynamic therapy. This involves injecting a special light-sensitive dye, called indocyanine green, directly into the corneal stroma. Then, a specific wavelength of light is shown on the eye.
And the light activates the dye.
Exactly. The activated dye helps to suppress the inflammation locally. It's a targeted way to knock down that immune response right in the affected tissue.
So stem cells and this light-activated therapy. What's the big deal about these compared to drops or implants?
The really exciting part, based on the initial reports, is that both of these treatments have led to long-term improvement, clear corneas, reduced blood vessels for up to 1.5 years in some cases, without needing continuous daily eye drops afterwards.
Wow, 1.5 years without daily meds. That's huge.
It is potentially huge. Now, it's still relatively new. More research is needed to see how widely applicable and consistently effective they are long-term. But the potential to break that cycle of daily, lifelong medication is incredibly promising. It could fundamentally change how we manage IMMK down the road.
That offers a lot of hope. So bringing it all together, what's the general outlook, the prognosis, for a horse diagnosed with IMMK today?
It's quite variable, honestly. It depends heavily on the form of IMMK. Those superficial forms generally have a better prognosis for maintaining vision and comfort compared to the deeper forms. That endothelial form we talked about is particularly challenging. Early diagnosis and starting appropriate treatment promptly definitely improve the odds. But owners need to understand that lifelong management is usually the reality. It's about control, not typically a cure.
And what does that mean for the horse's quality of life overall? Can they still live a good life?
Absolutely. With diligent management and owner commitment, many horses with IMMK can maintain good vision, remain comfortable, and live full, active lives. The goal is to keep the inflammation suppressed and prevent that progressive scarring. However, in severe cases, or if it's not well controlled, that chronic scarring can eventually lead to significant vision impairment or even blindness in the affected eye or eyes. So consistent care is key.
It really highlights the partnership needed between the owner and the veterinary team.
Definitely. It's a long-term team effort.
So we've covered a tremendous amount today about equine immune-mediated keratitis. We've learned it's this complex, immune-driven condition, not an infection. Diagnosis is careful work, ruling other things out. Treatment is often chronic, focused on managing the immune response, but with game-changing options like implants. And now, these really exciting new therapies like stem cells and photodynamic therapy are on the horizon.
Yeah, it's a fascinating condition that really shows how the immune system can sometimes target the body's own tissues, in this case the cornea. And seeing these innovative treatments emerge specifically for this equine disease is quite remarkable.
It really is. Which leads to a final thought to leave you with. We've seen these cutting-edge therapies, stem cells and photodynamic therapy, being developed for a very specific eye condition in horses. Think about how these approaches, born from trying to solve a problem in veterinary medicine, might offer insights, or perhaps even inspire new strategies you're tackling chronic immune-mediated diseases in other species, maybe even in humans. Something to ponder.